Welcome back to the Dr. Mollie James Show. Today, I'm so honored to have a dear friend of mine and colleague, Dr. Kat Lindley. If you don't know her, I don't know what rock you've been sleeping under because she is everywhere. She is the Independent Medical Alliance Director of International Fellowship. She is the president of the Global Health Project, and she runs Lindley Medical, a direct primary care practice. So she's actively out there and seeing patients. I think you're also on the school board. She is everywhere doing everything. So just before I let her talk, anytime someone tells me something happened on the other side of the world, so you could have a child in Zimbabwe that has a zit and a doctor that took care of it. She knows the kids. Her kids went to school with them. With the doctor. She knows everybody. So, Kat, welcome to the show. It's so nice to talk to you.
Thank you, Molly, and thank you for the intro because it's kind of funny, but that's our life, right? Both of us are like that.
Yes. Well, you're the connected one. I'm just your friend, so I know someone. Yes, it's wonderful. You spend so much time, but you truly do. You spend so much time building relationships and building a global network in the face of the tyranny that we just faced over the last 5 years. It is a huge commitment of your time, a huge financial commitment. You're traveling all the time. Tell us a little bit, what are the top 2 or 3 projects you're up to right now?
Yeah, so I always felt it's really important for all of us to be connected because we all were experiencing similar things and everyone was trying to kind of figure out what to do, how to get out of this mess, how to kind of get back to normal, as much as I hate that world. And so one of the big projects is the Independent Medical Alliance that used to be FLCCC. I felt it's really important for all of us to stay connected around the world. So the big project was really the fellowship program that we created. We have 48 physicians, we have 13 countries, I think 34 specialties, and it's really just a community of scientists and physicians who are still kind of trying to keep people informed, right? Because there is so much confusion out there. For those of you who are on X, I love actually being on X and doing spaces and listening to people talk, but there's so much noise, urgent news, red flags, and then you read it and you're like, okay, it would kind of be nice if you actually put the article so I can see what you're talking about because I'm not really getting what you're writing. So I think our fellowship program from the medical standpoint is important because you have this group of people who are trying to keep on telling the facts, keep on telling the truth. And as we're seeing with what's happening in HHS and everywhere else, there's still a lot of confusion.
Yeah, I would totally agree with that. And I think that pivots into one of the latest campaigns by IMA, which was Smart Moms Ask. We are off of the heels of a baby step in the right direction with Secretary Kennedy announcing that the COVID shots are taken off of the childhood schedule for healthy children as well as pregnant women. So explain how IMA became a trusted source on that and why moms have such an important role in making these changes.
So there was this rumor that HHS was going to remove the COVID-19 recommendations for children, but it really wasn't happening. They kept on going after the food dyes, the SNAP program, FDA is launching the AI hub and all of these things, right? So at IMA, we kind of felt that we need to start putting pressure. And what is the best way to do that, especially when it comes to our children, is moms and dads and grandparents, right? So we created this campaign called Smart Moms Ask. And the campaign launched probably about the week before the announcement was actually placed from HHS, but essentially campaign launch asking for HHS to remove your recommendation from children and pregnant women. Why did we choose those two groups? In my opinion, and I know you're the same, I feel like it needs to be removed from everyone, right? Yes. The time has passed. They have enough data. We don't need new studies. We don't need new articles in New England Journal of Medicine. We need none of it. We actually need to remove it. But, it's a government. It's kind of slow. So we figured, okay, let's go after the things that we know 100% needs to be done. And that is children. Children always did well. Children did not need this new product that has increased their incidence of myocarditis, even autoimmune diseases, cancer rates, A lot of these things that we don't see in children, we're starting to see them. So kids never have needed it. And then pregnant women, right? Um, Child starts in a womb. And we have seen increased rates of miscarriages, stillbirths, issues at birth. And the funniest thing is we tell moms, pregnant moms, you cannot have blue cheese, you cannot eat certain fish, you cannot eat certain things, you cannot take ibuprofen, past certain amount in pregnancy. You can only like take a couple of things, but this new product is fine, right? And that was one of the biggest lies in medicine we had. But I'll make it even simpler than that. If I come up with a new anything, whatever, piece of candy for that matter, anything new, any new product that I come up with, I can never claim safety coming out of the gate. Never. I don't have long-term safety data, so how can I claim it? So the world should have woken up to that first safety claim that we got. It's safe. I mean, I'm not even going to the effective side. That's been debunked many times. I'm not even going there. I'm just going to this safety claim. They could never have claimed that one. We should never have accepted it and leave it at that. And so this is kind of where the smart moms came with kids and moms and said, enough is enough. Take it off the schedule. And let's start chipping at this whole thing, one thing at a time. And the campaign itself, it's going to continue evolving because we have so many more things to accomplish. One of the biggest travesties, and I know you agree with me because you also have pediatrics in your practice with our good friend. But you have lots of parents who are going to their pediatrician's offices, and if they don't agree with the treatment, if they don't agree with the plan, pediatrician is like, "Oh, you have to leave the practice. You have to find someone else." When have we ever abandoned our patients? It's like the weirdest past 4 or 5 years that's happened in medicine. So smart moms are also creating a website where parents can go in, write down questions, and fellows and staff at IMA is going to try to answer as many as possible. So at least there is a database of these rolling things. And then when you go to your doctor, you're going to have your own informed consent, right? You're going to know things. And when your doctor tells you, well, this is safe, you're going to have type of questions that you can ask and say, well, why is this safe? And I think we also need to turn the table at the whole industry, HHS, CMS, everyone. I don't have to convince you it's not safe. You have to convince me it's safe.
Yes. Yeah, I totally agree with that. And the ludicrous idea that we're recommending a vaccine to protect your child's health, but if you don't do it, now you don't have health care at all. I mean, that's
Yeah.
idiocy. That's just, I don't even know how they can defend that. And I don't know why more families aren't going on the offensive and writing these doctors up to the medical boards and saying, they coerced me. They tried to abandon me. Like, we need to stop being on the defensive. We need to be on the offensive, I feel like, because we are correct. We are ethically,
Yeah.
morally, and legally correct.
I agree with that, but I think what's happened, I've been thinking about this a lot, and this is why both you and I are practicing independently, and why both of you are champions of independent practice of medicine, because then you can have market decide where they're going to go, right? Parents are in charge, and they can decide if they like me, if they like you, if they like how much we're charging, if they like the things that we're offering. But I think American people are just starting to realize now that they've been prisoners of the system, for lack of a better word, right? They're like, my doctor told me to do this, so I have to do it. When in reality, no, your doctor gave you a medical opinion based on their years of education and practice and experience. You still have the autonomy to say no. I don't even want to go into a statin conversation per se, but like, I have a friend who recently went to the doctor and the cholesterol was like 150s. HDL was only 40, LDL is 107, and this person got a huge lecture how they're going to have a heart attack and they need to take certain medications. And I'm thinking to myself, the number is barely up. We actually keep on changing that number because we started like at 199, then it went to like 160, 130, then 100. Some are even saying 70 if you have some risk factors. But what people don't realize, that cholesterol that you keep on trying to treat, you need it for your hormones, you need it for your brain, you need it for all the organs to actually function. So you're causing damage by chasing a number and not looking at this person that's essentially healthy and doesn't need much.
Yeah.
So,
Yeah, I would totally agree with you. And I'm actually in my practice, we treat a lot of thyroid and optimize a lot of thyroid, and we're seeing the
mhm.
cholesterol numbers totally normalized when the thyroid is dialed in.
Yeah,
So
the first thing you have to do is actually go after the thyroid, but they all forget that little pearl, right?
right. Yeah, they just isn't put into perspective, right? You hit the diet, you hit this, you hit that. And then if there's still a problem, we can talk about what the options are.
Yeah.
But there's even data out now, and again, we don't want to get caught on statins, that lowering LDL doesn't improve your cardiac outcomes.
Yeah, they have to actually look at the composition of the molecules to decide what are the risk factors. And it's like we've been taught for the past several years, and well, I don't think when I was in medical school, which was a while ago, I actually did the math, and it was really a while ago. Um, it wasn't that bad, but now everything's protocol, everything's number, everything is like you have this, you do this. It's like there's no thinking. So we don't practice really independent, individualized, not independent, individualized medicine. And what we don't realize is like I may respond to this. You and I can have same exact numbers in everything, but I may respond to this. You may respond to that. We actually are not going to have the same necessarily response to this, to the treatment or options that we have. So people kind of forget that. And then, this doesn't work. They keep on dumping more and more stuff. So then you end up like leaving your doctor's office, you're taking 5, 6 medications. Some of them are twice a day, and then you take all the supplements. So at the end of the day, they have like 15 pills to swallow. When in the meantime, you know, I grew up in Europe, and my dad had issues, but the rest of my family was healthy. And essentially, you walk everywhere every day. You buy food that you're going to eat that day. You don't buy like food and keep it in your freezer and stuff. You cook it. You go outside. You sit at the table with your family. One of the big things, we are kind of Mediterranean town, so we're all big musicians, right? On Sundays, everyone comes to it used to come to my mom and dad's house. We would bring our guitars, sing, play cards. All of these like things that I took for granted actually built the immune system. All of them. And those are the simple things that we've forgotten because we're so busy. You go do this. You have to be out of the door. You get your coffee on the go. You're yelling at kids to get in the car. Put a seatbelt on. Did you make your lunch? So by the time like you even drop the kids in the morning, do you know how much stress you've gone under? And the cortisol that's been released, and so that's really the risk factor for being unhealthy, the lifestyle that we have. And then forget about the food. You buy things, they're in the freezer, or the bread. I love bread. I'm a total carb person. I've done like low carb, but I always go back to my carbs. So I love bread. But do you really think about how much preservatives are in a loaf of bread that's supposed to keep for a week? You essentially are eating chemicals that look like bread.
Mhm. Yeah. Yeah, you're totally right. And back to your point about where we've gone depersonalized medicine, I've actually heard in the hospital since I've left. So in the last 5 years, they give the clinicians the labs, and the automated spits out the meds based on the labs. So they have an
Wow.
integrated report. Yeah, so it's just check boxes. Um, so it is the furthest thing from medicine that we have. And I have a major problem with these companies now that are coming on and advertising, oh, get your happy pills here. And it's a text
Yes.
based service. Like, tell me about your depression via text, and I'll just ship you your pills. So tell me, you understand a lot about healthcare policy, and I don't even
Mhm.
understand how these companies can exist based on their format. How can they, and what can we do policy wise to get rid of that? Because that is not medicine.
Yeah, I think there's a lot of uncertainty now with AI. I'm sure you've kind of seen the news where different tech companies have contracts with HHS. They've had it with CDC since the COVID era to help with distribution of vaccines and emergency kits and all that. They have access to FDA, again, our Medicare and Medicaid. That's very scary. I can see where AI can kind of, you can use those tools to maybe look at patterns and then make decisions. But I think when you allow the AI to make those decisions for you, that's when you get in trouble. I don't know if this is, I didn't see the clip myself, but I've seen a comment from one of our friends, something along the lines that like CMS like the idea of using AI because it's going to cost like $20 for a counter versus, 150 or whatever they charge for different levels of encounters. But what people don't realize in the, like, I know AI can do a great job, right? Because you just give him facts, you give them labs, and they'll give you the most common probability of what may be happening. But what they forget is, and I know you know this, we're both DOs, we actually go on instinct a lot. Because you and I will see a patient and I won't necessarily know what is triggering red flags in me, but there's something in their posture that's telling me I need to do this.
Mm-hmm. Yep.
People don't realize this human element of medicine that, like, even when I'm just talking to the patient, my brain the whole time is kind of computing and looking up. It's like, why are they hunched forward? Is that the pancreas that's bothering them? Or, why are they having pain in the back and hiccups? Is that the gallbladder? Like, is AI really going to pick up these visual cues that you and I see? No, they're not. They're going to look, and they might actually still get the right answer. I'm not saying that, I think AI is going to be very good to a certain extent, but there is this human element, this human instinct that they'll never get. Now, when it comes to policy, there's not enough doctors in healthcare policy. There's not enough doctors in Congress. And the ones that are in Congress have stopped practicing medicine a long time ago to really understand the depth of how broken the system is. Whatever your opinion of Dr. Oz is, he hasn't really practiced medicine in a long time. And even when he did he really ever build CMS and to realize that to actually get the highest pay, right, on your encounter, you have to check boxes. So if you have someone with diabetes, not only do you have to do labs every so often, even when you don't need them, by the way, because if diabetic is controlled, do I really need to get their blood every like 3 months? I don't if they're really controlled. But no. The CMS requires you to do certain labs, certain calculations, certain vaccines for that patient because they're at high risk, certain medicine, even when the numbers don't ask for that medicine. You're supposed to put them on ACE inhibitors even when their blood pressure is completely controlled and their renal function is normal. So these are all these little things that you're supposed to do that you get reimbursement. And when you work within the system, if you don't do that, your employer will come to you and say, you're not getting optimized billing. You need to do another, a couple hours with our biller so you know how to code. In the meantime, you're not taking care of the patient. You're trying to fudge the numbers to get the reimbursement. So there's so much that needs to be done kind of there. And then we need to really get control of the AI in medicine. And you have companies, like you said, who prescribe these happy pills and whatever. They barely even have the encounter with a patient. And they're like, oh, or like, these kits. It's like, you want this, you can have it. That's not how it works. Like, I don't just give patients antibiotic to hoard at home because they don't really understand the timing of the medicine, when to take it for what and things like that. So I think we're doing more harm than good.
Yeah. And my other concern with that too, so they may think it cuts cost up front because it's $20 instead of 150, but long term I think it's going to cost us so much more because of all the
Oh, yeah.
misdiagnosis and the medications. And I'm sure you do this too when you have a patient who's depressed. That's a symptom of something and we don't
Mm-hmm.
match the pill. We need to figure out why. And that's a solvable problem if we're smart enough clinicians. So I just think we're going to skip over so much of what needs to be done in the to do knee jerk medicine to fill a
Yeah.
prescription. So um, let's shift gears for a minute. Let's talk politics.
Ooh,
I know.
actually, I love politics, so I'm good with that.
Yeah, yeah. So we've got Maha and we've got MAGA, and we've got a base. And you and I have talked about this a lot offline. Um, we've got a base that firmly supported President Trump, has his back. We have for a very long time, but we're raging mad about these COVID shots and how this has been handled. He got booed at his own rallies, so he knows it. Why is this a blind spot for the administration, and where do you think that needs to go?
So, I've always been MAGA person. Even in the first administration, I worked with the administration on different things. I really feel that President Trump gets the business side of healthcare really well. And there are so many policies and recent executive orders where he's really good. I think, I know what you're talking about, that John Rich interview or a conversation they had when he asked him, like, why are they booing me? And John Rich said, well, because of the vaccines and the people who are suffering afterwards. I think President Trump was starting to get it. And then there is this collaboration with Maha, right? I get the idea of making America healthy again. But as I often post on X, you cannot make America healthy again unless you address the mRNA vaccine platform.
Mhm.
The platform is harming people. I'm not saying it's a bad platform potentially. I personally feel that they haven't figured out how to deliver the product they want to where they want to deliver it. And because they haven't, it's causing havoc in our immune system and attacking our immune system. And essentially, our immune system now is blinded and has no idea what to do. So you have people who are getting sick with colds all the time. Like even, strep and flu season was actually pretty bad this year because the symptoms were kind of severe. And then you have people who have truly been injured and some people died. That needs to be addressed. Um, I'm hope, and when the MAGA moved with MAGA, that message that President Trump was starting to get got kind of lost in the shuffle. And then we went towards red dyes, SNAP program, seed oils, and people don't realize I'm all for it. I'm on your side on it for sure. I come from Europe. I know all of this. The food I eat when I'm home is I can eat like huge amounts of food. I don't gain weight. My blood sugar doesn't spike. Everything because ingredients are wholesome and good. I get it.
Mhm.
But what these people don't get is that's a choice. You can choose not to buy the Fruit Loops. You can choose not to buy Cheerios. I'm actually partial to Frosted Flakes for those who don't know. I can choose not to, and I do, but once in a while when I'm kind of moody, I'm like, Frosted Flakes sound good. But my
Yes.
point is, those are choices.
Mhm.
mRNA has not been a choice for many people and has injured many. So I think the path forward for the Trump administration is to truly look. We don't need studies. We have studies. I love when certain people in administration on HHS said, we're going to do whatever blinded placebo, whichever studies they said they're going to do. And I'm like, uh, it's kind of unethical to do studies at this point because we know it's harming people. So who are you going to study?
Right.
So you don't have to study, just go to your pharmacovigilance. Even if you take 1/3 of your pharmacovigilance data, you will actually come to the same conclusion. Because which shot was it, Molly? You probably remember better. Wasn't it the 13 cases of interception? Was that rotavirus?
Yes. Yes.
Yeah, 13 cases.
Yeah.
13. How many thousands do we have now?
Yeah.
Even if you want to take a fraction of what you have the data. If they don't want to abandon the whole platform, I get it. People don't like banning things, I get it. Halt it.
Mhm.
Halt it. Reevaluate it. In the meantime, address the true epidemic in chronic diseases, which is vaccine injured.
Mhm.
Vaccine injured are getting diagnosed with later stages of diseases. Someone like I have autoimmune disease. I've always had it, but mine progressed over time.
Mhm.
And and I'm managing it and I'm trying to do the right thing. But we're having patients who are coming into late stages of these diseases that they never had because of this rapid progression. So these are the things that we have to address. And until we start really addressing this elephant in the room, we're not being serious about the problem.
Well, and I think that's where a group like IMA draws criticisms from both sides because we're actually just speaking the truth. And when you speak the truth, it makes people mad who are one topic advocates. So, yeah, we want healthy food, but, and this is my analogy, if someone's holding a gun to your head and you're eating a non organic brownie, which one do you think is going to kill you first? Like, let's get the gun off your head first. And that to me is mRNA. And I think the reason we get so passionate against these people who have showed up out of nowhere and they're talking about Fruit Loops is because they're distracting from what we've been doing for 5 years and they're shifting focus. And it's like we have to prioritize the greatest risk, just what you said. And that's taking away from what we're trying to accomplish. And we're out here in the streets taking care of these people and looking them in the eye,
Yeah.
injured with no
I was
end.
just going to say that, Molly, because I don't know if they think that we're jealous. By the way, I would like to, I would like them to switch places with me for maybe even just 5 hours, just to see how many emails I get to people that I've never met. And it's like, my mom is vaccine injured. I have this, I have that. What do I do? Right. And then people don't realize the sheer volume of what we're seeing. And it's not being addressed.
Yeah.
People are suffering. And while I feel that President Trump, um, to a certain extent, had a blind spot, I really feel that his eyes have been opening and he put people in place to address it.
Mhm.
I'm not sure that they're addressing it in the way that I would, but we're supposed to give them grace and time.
We'll give them a little time. And that's what I thought. I thought Maha was so brilliant because I thought you
Yeah.
took the best of what Bobby Kennedy has to offer with the best policies Trump has to offer. You bring us all together,
Hmm.
but give us something. Like we unified. So give us something for getting you there. We're waiting for results.
But even, even the recommendation that they came up with the kids, by the way, I don't know if I missed the one for pregnant women, but I don't remember seeing that. But the one for the kids, they actually did take the COVID-19 off that line, and it says see notes, and then notes say uh, parents or guardian and clinician can decide if the child benefits from it. But when you go back to actual recommendations of what they have, they consider everything a chronic disease, right? Even like mental health issues with, for example, ADHD would go under mental health because of DSM categories. That's considered a child at risk. So parents who have a child with ADHD could be pressured into doing something that the child absolutely doesn't need.
Right.
So, their guidelines, it was kind of a lukewarm thing just to maybe make the base a little bit happy. You know, uh, Someone asked me right after for an interview, and I said, I'm not happy. I don't like it. But at least, like, I don't see that line across for now. It is disappointing because we still know, you and I know that people are still going to be pressured. And I'm just hoping they'll do better. And and you and I spoke about this. You and I are not worried about COVID-19 anymore, right? I'm not truly worried about COVID-19 vaccine that much anymore because parents are not doing it. Uh, Elderly are not getting boosters, but we're worried about the mRNA platform.
Yes.
And that's what people have to realize. We still have mandates when it comes to healthcare workers and nurses, and they technically are not there, but they're there, so schools can still ask for it. And next year platform for flu shot, one of them is mRNA. We have, I think about we have several hundreds of new products in the pipeline that are on mRNA platform. And as I said earlier, we haven't figured out the mRNA platform. They haven't figured out how to deliver the thing they want to deliver specifically to one spot. It's being delivered everywhere. And until they figure out that even one point, they cannot do these new vaccines. And then, I get that they want to do trials. I'm all for it. I would love trials, really true trials. But from the ethical standpoint, knowing that this is causing damage, how can you actually ask anyone to go into trial?
It's a good point, and nobody's brought that up but you so far that I've heard. My
Well, I worry about the ethics of the whole thing because, again, informed consent. They cannot give us informed consent. They don't know it.
Yeah. But you have their side saying, well, randomized placebo-controlled trials aren't ethical because you would rob someone from having the COVID shot. I mean,
Yes.
have the bigger microphone, and what you say makes so much more sense and is so much more accurate. My biggest day-to-day concerns now, because you're right, COVID's in people's rearview mirror, right? You either decided to get the shots or you didn't, or you did and now you don't, or you're lining up for
Hmm.
every booster. Like, that's decided. My problem is this is the hardware. COVID was
Yeah.
just software. That was just the program that ran. That hardware is there every day. And the tyranny, the overreach of the medical industrial complex, the lack of informed consent, the giving kids shots behind parents' back at school, that framework still exists. And people have stopped fighting it because it's not an urgent threat today. But it is going to be an urgent threat tomorrow once the next software program gets loaded.
Yeah, and I was actually in space last night. Stella Emanuel was talking, and she was talking about the recent exercise the government agencies kind of did on a rapid response, and the virus they used was a Nipah virus, right? Which is kind of a big deal. It has high, mortality rates and stuff like that. So instead of like talking about how we can treat Nipah virus, because we actually can, there are some medications that are very promising. There, a mechanism of action would work really well on this. And if you come up with a early treatment plan and how we actually even could do things now, not knowing what the possible viruses are, because what CMS should do is incentivize doctors to increase immune system. And how do you do that? Check the vitamin D level. Make sure vitamin D level is optimized. Check their thyroid functions. Make sure that hormonal axis is working well. You can do these little things that we as family doctors are supposed to do anyway. So you can actually incentivize a whole group of primary care doctors to do the right thing instead of trying to find a code that's going to cover vitamin D, because vitamin D is rarely actually covered by insurances. So that's another rant for another day.
Mhm.
But instead of like talking about how do we optimize the health of our people
Mhm.
so that they don't get sick, they're like, oh no, if something happens, we're going to produce a vaccine on this platform that only takes a few months to actually give us a product. We're going to do the testing with PCR that actually shouldn't be used for diagnosing anything. It's only used for confirmation.
Right.
We're going to, do this. We're going to do that. They have like a totally upside down view on the world, because like what you and I would think is like, okay, flu season is coming or strep season is coming. How do I get the kids not to get sick? Right? We tell them to eat good food, lots of vitamin C, take their elderberry, sleep well, and things like that. And they're like, oh, no, 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 no. The flu season is coming. Let's have a new test, new vaccine, and new medication, because that's how it should work. The
Yeah.
whole thing is upside down.
Yeah. And I don't know about you, but one of the most disheartening things through all of this, and it continues today, is I look at colleagues that I used to just, my default was to respect my colleagues,
Hmm.
to assume they were highly credible, to give their viewpoint credence and incorporate that into my world, assuming there's a lot I don't know.
Hmm.
That has changed because anytime one of these doctors recommends a COVID shot, I'm thinking specifically of the ACOG group who just spoke up
Hmm.
against HHS recommendation, and said, "We stand firm that we want pregnant women to get this despite the data." That
Hmm.
to me, anyone who recommended that, I just disregard their opinions about everything because if they're so blind to that fact, what else can't they process through the right lens? And so there's very few colleagues I trust right now. So those of you I do, I love to death.
Yeah, I feel the same way. there is couple that like, we text all day long in our chats and things like that. But one of our good friends, well, Linfin, last night I was in space with Stella, and I was like, okay, so if this virus hits, what are we going to do? And then it's like, if this virus hits, are we going to do this? So I have like this whole little thing, down specifically on, what type of viruses, family and stuff, what type of medications tend to work, because, you know, not only do I want to be ready, but I'm asking questions of people that I trust, because you're right. We cannot really go by our professional organizations anymore. And if you look at their memberships are down, but they are financially stable. Why are they financially stable? Because pharma gives them a lot of money. And this is where, my long-term vision for Independent Medical Alliance is continue doing the work we're doing with mRNA, because we truly are seeing the damage in the population. Start asking questions. We actually had a call, you were on it, and we had a big uh, discussion on just the vaccine schedule itself. And some people are like, oh, these things are not good. Some people are like, well, some of them are still good. I want to see, better things. And that's what you need to see. You need to see a group of scientists come together and go one by one by one by one and say, okay, this makes sense. This doesn't make sense.
Mhm.
The other thing that I'm looking kind of as a long-term goal for this organization is to truly become a independent home, not only for physicians who are leaving these professional organizations that don't share their values anymore, but also a home for patients, where patient can have a resource and say, okay, this is what I've been told, but I don't really think it's right. So what do these doctors think? Because there's much confusion in the world right now, and trust has been lost on both sides. I do think that some of our colleagues, with some of their statements, are propagating this loss of trust, and they need to dial it back a little, because I'm sorry to say, for those of you, you might not like me after this, but medicine is still good. We still do great things. If someone is having right lower quadrant pain, it started like a nagging little ache. All of a sudden now you have fever, the pain is getting worse, you're barely eating, and when you walk, it hurts like hell. I really hope you go to the hospital and you have a good surgeon, because that appendix needs to come out.
Yep.
Your, essential oils are not going to help you on this one. So we need to find that balance where we see the value of traditional medicine. We also learn, I know you do a lot of functional medicine, so you have this whole armoire that you can bring in. We all need to learn from each other. We need to learn from patients, right? Because patients know their body, and they can tell you, if I try this, it works. So we need to really expand,
Mhm.
this thing called medicine, but we need to stop putting the whole profession down, because the profession still has a place in this world.
Yeah, and that's one of the things that I've defended for a long time, is this, that evil surgeon. I had when I was doing surgery, I was starting into integrative medicine, and I had somebody who wanted to meet with me to collaborate. And I did a social media search, and she had posted about evil doctors ripping out gallbladders. And I
Yeah.
said, I'm not meeting with you. I'm not meeting with you, because that is not right. And that is not someone I can work with if you think everybody's the enemy. And we can't think everyone's the enemy, because we have patients who need these resources. And
And sometimes gallbladder is too sick and it does need to come out no matter what you do, because you tried everything else.
yes, yes, I took gallbladders out. I'm not evil, but my
Yeah.
patients matter because I did it judiciously, right? And
Mm-hmm.
we don't want our patients in fear when we do have to send them, number one. But there's a place for all of this. And if you
Yeah.
take call for a specific condition, I'm going to rate your opinion on that a little bit lower than someone who has to deal with the emergency on that, who's up in the middle
Mm-hmm.
taking care of those patients. So, it's all a big hierarchy in my brain of whose opinion I value depending on their specialty and what they're
Mm-hmm.
planning on and things like
And
that.
there is a place for everything, right? It's not one size fit all. Some people do really well and they're really healthy, and all they do is a couple of supplements, eat healthy, do yoga and different things, and they don't need anything. And then you have some others who actually need a little bit more pharmaceutical help, and not all pharmaceutical is bad, but it's all balanced. You look at the risk and benefit, you make sure patient understands that the cornerstone of ethical medicine is informed consent. And if there is a decision making between patient and physician together, you really can't go wrong. The but this is kind of where we need to help restore the balance, because in my opinion, patient is in charge, not the doctor. I always consider myself as a cheerleader or a guide or someone who will, like, I'll say to them, well, this is my opinion, this is what I think is best. But if you don't want to go this route, we can try this. And then if that doesn't work, we'll come back to this. And then you go kind of back and forth, and they're like, well, that works for me, but this doesn't, because I'm not really good at taking the pills of remembering. So let's try, but it has to be a conversation. What has been happening in our profession for too long is doctor gives orders, the nurse comes in and yells at patient if they haven't done it, and the patient leaves and they're like, they have that blank stare and they're like, I don't want to go back to the doctor again. At least I have 6 months until I have to go back again. It's like, it's been a traumatic experience, really, I think.
Mhm. It has, and that's where practices like yours and mine, we wanna be your trusted source. I wanna meet you when you're not having an emergency and on your worst day.
Yes.
We can get to know you so that if you do have a bad day and you are faced with a health crisis, that I'm there for you and we can help you walk through it and it's not so traumatic. So, we have slightly different models. You do the DPC, I do the
Mhm.
concierge. They're a little bit different. Um, Explain to patients why escaping the system, I know you're a huge advocate for this, so am I. Explain to them 2 or 3 benefits that they're gonna see immediately once they pop out of the system and go to doctors like us.
So I've been doing this since 2017. I've had a friend who's been doing it for even longer, and I would not do it no matter how much he told me that I should, because I like the idea of working, coming in, not worrying about, bills being paid, going home and being done. And then something happened where I wasn't happy with my prior employer, and I decided to go on my own. For those physicians who are out there thinking about this, short story is I took $5,000. I found a place to rent. I used my doctor's bag from medical school. I bought a UA, strep test, and flu test, and essentially opened my practice.
Mhm,
And as I opened it, it grew and all that. But even now, I'm pretty minimalist. I'm still on my own. Um, I do some procedures and things like that, but I don't do anything too expensive just because, like, it's not something I wanted to do. I didn't feel it needed to be done for my population. I don't have like this wonderful lobby, with great tones and all that, just because it's not something that really matters to me. I have a nice practice in a town and people love it. I love it. So
mhm,
it can be done. You can spend hundreds of thousands doing it, or you can spend probably 5, 10,000 and start and build the practice, right? Now, from this patient standpoint, the first day I opened the practice, well, actually the first week, I kept on coming to my office early, staying all day. And, I had a couple of patients at the time, and I would be like bored and stuff until I realized don't have to be in my office unless I have a patient to see. And the same thing for my patients, right? They all have my cell phone number. They all can text me, tell me what's going on. If I feel it's something that I can handle and I don't need to see them, I'll just tell them what we need to do. If I need to see them, I'm like, okay, come in like an hour, half an hour, come in the morning. It's my own schedule so that I can choose whenever they come in. But I
mhm,
think the most important aspect from the patient standpoint is access to me.
mhm,
They don't have to go through, the front desk who doesn't know where the doctor is when the doctor is going to return the call or return the email. So I think access is probably the most important thing. And the other thing is, if they need something, I'm like, I don't need a zillion and one test to be able to order this one thing that I really want.
mhm,
I just go and order this one thing they really want. And then they have two options. They can use their insurance if they have it for labs, for x-rays, for MRIs. We definitely use it for medication and stuff like that. Or they can shop around, because you and I know that the blood work can be very cheap. It doesn't cost $150 to get CBC. It costs about $3. In some places, even less than that. So they have this option of being in charge of their money and deciding how to spend it. So some of them have like HSA accounts, so they'll choose to use the HSA accounts. Some people don't have insurance, they just pay cash. And they know that I'm not going to order things I don't need, right? I don't need to order all of these zillion things. I don't need to send them to specialists unless I don't know exactly what I'm doing, because there's a lot of things that family doctor can do in their own office. You don't need to send them out for sutures. You can actually do them in your office. You don't have to send them to the ER and have $1,000 deductible and costs for 3 stitches or something like that. So there is this, my biggest thing in doing independent medicine is to really teach patients that they are in charge of their health, not only in decision making, but also how they're going to spend their money. And I think when you have a family and when you have a future you want to plan for, it's really important to know that you're the one making decisions.
Yeah. Yeah, I couldn't agree more. Kat, our time is coming to a close. I knew it would fly by. We
I
did.
can talk a lot, so
Right.
yes,
Well, for sure. Remind people where they can follow you, where they can find
sure.
you, how they can sign up to be your patient.
So I am in Texas, and my practice is lindleymedical.com. I actually am expanding a little bit to other states. Um, you can also find me on X. It's KL Veritas on X, and that's probably the best way to follow me because you'll get my opinion on things. And sometimes I'm sarcastic, so like you better like read the follow up because I might be actually just making a snarky point and not. Uh, and for those of you who don't follow Molly, you should be following Molly on X. Also, Dr. Lynn Finn and Mary Tally Bowden, because my favorite thing is when these three ladies get involved back and forth with someone. I just sit back, watch, and you guys, you guys are lots of fun. So yeah,
We,
come to X, and we should do a space together one time.
we
Have
should.
fun.
We're kind of a Twitter girl gang, if you will.
Yeah,
Get seen in there too.
definitely.
Amazing. All right. Well, it's been an honor and privilege, and I'm so glad to be part of IMA and to be part of the group because, as Kat said, if anything's coming down the pike, this group is going to know about it. They're going to have an answer for you before it's a problem for you. So, we distribute that out through my clinic. Kat distributes that through her clinic, and you will have the latest and greatest if you are a patient of one of us. So, I really appreciate you being here. Thank you so much for listening. Make sure you follow her. Make sure you follow Honest Medicine, IMA. Follow her clinic and all of our colleagues. So this is the way we spread our network. We beat the censors and we make an impact. So thanks for being with us. Make sure to subscribe to the YouTube, Spotify, and Apple Podcasts. Make sure to give us a rating, and we will see you next time at the next episode.